very much, and it's great to see so many people in the room. I understand this was very quickly kind of booked out, so it's really fantastic to see that the tumour summits have kind of resonated so well in the sector and with our kind of consumers. So I'm kind of here today to introduce the broader kind of government and policy context in which the work of the tumour summits and the work that we're undertaking in lung redesign happens. So firstly, Victoria has been at the forefront of evolving state, national and international approaches to improving cancer outcomes. We go back right to 1936 when the government introduced an act to establish the then Anti-Cancer Council of Australia, and going forward to 2014 when the current Improving Cancer Outcomes Act was implemented. We have a significant program of reform that has changed the landscape of cancer control in Victoria. So the current Act requires us to develop a cancer plan every 4 years, and the Victorian Cancer Plan 2016 to 2020 was released in July 2016. So this plan is the key element which articulates the ongoing reform agenda we have in Victoria and defines our priority areas for the cancer sector. So in that plan, we have a number of goals. So they are to halve the proportion of Victorians diagnosed with preventable cancers, double the improvement of 1 and 5 year survival rates for Victorians with cancer, ensuring Victorians have the best possible experience of cancer treatment and the cancer system, and achieving equitable outcomes for all Victorians. So we've got 5 priority action areas around prevention, screening and early detection, treatment, wellbeing and support and research. And each of those areas are underpinned by a number of principles around person-centred care, equitable access, prevention-focused, care pathway focused, which is partly what we hear today, quality and safety, evidence-informed and sustainable system. So while Victoria kind of cancer outcomes are relatively positive when we look at other jurisdictions, we actually know we've still got a long, long way to go. We know cancer is the biggest burden of disease in Australia, causing substantial social and economic impacts on individuals, families and the community. And we also know that there are significant disparity in outcomes around regional and lower socioeconomic areas, extremely poor outcomes for our Aboriginal communities, and variation in outcomes between tumour streams. So we've still got a lot of work to do to move to our optimal state and ensuring that Victorians with cancer receive timely access to the best care. So our optimal care pathways are the key tool that we are using here in Victoria and nationally to achieve this best care. They map the journey, aiming to foster an understanding of the whole of the pathway and determining what should happen at each distinct component to promote quality cancer care and patient experience. And importantly, they're intended to help both clinicians and patients understand the optimal care that they should be receiving at each step. So they help to define what we want to be, and importantly, that they are endorsed at a national level, they are known and agreed by the sector. So with the optimal care pathways, what that allows us to do is map the current state of affairs and identify the gaps of where we want to be and focus our effort. So we have deployed, as part of this process, a number of resources to tackle the shift towards the optimal care in a multi-pronged way and across the state in a coordinated way using best practice methods. And the final message is we are in this for the long haul. We don't see this as a one-off event. As this tumour summit shows, this is the second time round to look at how we can continue to improve care for lung cancer patients. And we want to see it as a long-term and ongoing effort. So this is an example of, I think, one of the programs that came out of the last tumour summit around the lung cancer redesign grants. I understand there might be a presentation on this a bit later, so I will skip over this one though, but you'll get more detail going forward. And just kind of highlighting, here's a second example of an optimal care implementation program of work, which was a collaboration between our ICS and the primary health networks, which took information from the lung optimal care pathway and incorporated it into the Health Pathways website, which is an evidence-based local tool that helps GPs assess, manage and refer their patients into tertiary care. Importantly, we've kind of touched on what's happening on a Victorian basis, but obviously there are several major national initiatives happening in this space as well. The key thing that I want to highlight today is Cancer Australia's Lung Cancer Framework. This is a national resource for health professionals and service providers. It provides evidence-based best practice information, strategies, tools and resources to support local adoption of the principles in the delivery of best practice cancer care to lung patients. And importantly, the context of the framework aligns with our optimal care pathways. So it's a clinical resource that identifies specific steps along the care pathway and recommended care at each point. And finally, as I mentioned earlier, given the poor outcomes we have for our Indigenous community in Australia, we now have an optimal care pathway for Aboriginal and Torres Strait Islander people with cancer, and this kind of guides culturally safe and responsive trauma-informed cancer care. And this is being led out of Cancer Australia around supporting adoption across Australia. But importantly, here in Victoria, we are moving towards self-determination for the Aboriginal community. And what that means in practice is over the coming year, across the department, including in the cancer team, we will be looking at opportunities to devolve control of initiatives for Aboriginal communities to local Aboriginal organisations to ensure that it is the local people that are deciding what is best for their local people. And just finally, just some acknowledgements before we move on. Obviously, a big thank you to the Cancer Summit Clinical Working Party, chaired by Mr. Gavin Wright and Dr. David Ball. Another big thank you to our integrated cancer services who do all the grunt work out there at the local level and do some fantastic work, as I have been pleased to see over the past few months I've been in this role. Thank you to my own team, who also do fantastic work. Cancer Council, who collect the data through the Victorian Cancer Registry and do the data analytics on that, which is the envy of the rest of the department, I have to say. And finally, to Cancer Australia and the support they provide to this program. Thank you.